My name is Dr. MAZOR. I am from Israel. I am a teacher at the specialization program at the Jerusalem University, and my main focuses of topics, it's on lingual orthodontics, on mini screws, and on cephalogating brackets. I also been involved in research and development, and I am helping to develop new philosophies and systems in orthodontics. Concept of orthodontics is to get the well-being of aesthetics, of function, to get a perfect harmony and beauty of the face and the smile. Orthodontics is using or fixed appliances or removable appliances on the teeth in order to move them to get the best position and the treatment results that we desire. Today, the treatment options for aesthetic treatments are or lingual braces or clear aligners. There's basically a huge difference between the two ways of working. Lingual appliance, it is a development which was taken from the buccal orthodontics, that means brackets and wire bonded on the teeth. Clear aligners is a different concept. It's using plastic in order to, like a removable appliance, that to put them on the teeth. So basically, clear aligners is more been, let's say, dependent on the patient cooperation, so they need to put it on the teeth, and they need to be also dependent very much on the quality of the plastic, because we are talking now about elasticity of the plastic. The quality can be different from company and a company, and can be also different with time, because they lose from this quality. Basically, all types of patients can beneficiate lingual appliance. It doesn't really matter the age or the gender. In the past, in the old fashion of the lingual appliances, there were more, limitations for patients to be treated by lingual appliances. Today, with the modern and CAD/CAM and the individualized systems, basically the lingual appliance can fit almost everybody. The only limitations that we find when we talk about lingual appliances, it is the fact that the patient has to be very careful with oral hygiene. And that can be a limitation also when you have patients with periodontal problems and they do not keep very well oral hygiene, are not a good candidates to be treated with lingual appliance. Comfortable, this is something which is, it's relative, we call it. We know by research and also from the clinical experience that it is more difficult to get used to lingual appliances because these appliances are mounted on the lingual side, on the interior side of the teeth, and they interfere with the tongue space and function. Again, in the old type of the lingual appliances, the inconvenience was bigger because the brackets were bigger in size, they were bigger in profile, higher in profile. But again, in the new appliances with the advanced type of systems, like the eBrace, for example, the size of the bracket is smaller and the convenience is much improved. Also, convenience is something which is, patient dependent. We see that some patients get used faster, different patients get maybe slower. And by the way, it is the same for buccal orthodontics. Also, buccal braces also create some inconvenience for the patient. So you see that some patients get really fast, get used to it, and others takes more time. Today I can say that it is almost the same, but lingual appliances take a little bit more time to get used. Lingual appliance can be very easy for the doctor. It is true, it is more time consuming than buccal orthodontics. I mean, it's faster to ligate maybe the wires and everything in buccal orthodontics. But it can be very easy for the lingual practitioner as well. It is a matter of learning curve and getting some experience. From the patient point of view, it is exactly like I said in buccal orthodontics. I mean, it is all hygiene and be careful what you eat, but basically same. No special instruction for the patients. I would like to make first the comparison between individualized and not individualized system. For buccal and lingual, it is the same. I mean, when you take a system and make it individualized, you make it much more accurate. Suppose it's supposed to be much more accurate because you take in consideration individual characteristics of the patient's teeth. So basically the idea is to get a much more accurate appliance and therefore faster treatments because you have less adjustment time. The average treatment time for buccal orthodontics and lingual orthodontics today with the individualized system, it's about 1.5 years. Depends of course on the malocclusion. It can be different if it's an extraction case or non-extraction case. But as a concept, individualized system should be faster, should be, more accurate than the regular systems. I met eBrace 6 years ago, and I can say, talking about development, I can say that eBrace is doing a lot of efforts by teaching, learning, investing money, research, in order to have the best appliance they can provide. And if you talk about development again, they really developing fast. I believe the future of orthodontics, lingual orthodontics, in China, it's very good. I believe they have got a really very high level, and shortly they'll be exactly like the same of the world. And I believe also that lingual orthodontics will get also very popular in China as the doctors learn more to work with it, and because there is an increasing demand for aesthetic treatments.